Hello, everyone, and welcome to another episode of the Daily Rinse. I am your host, Chris Barth, and this is episode number 8. The topic for this episode is oral cancer. And I wanted to sort of focus on oral cancer this week because every time I see a patient for an initial evaluation, I perform a cancer screening extraorally and intraorally. There are many things that can contribute to or increase the risk for someone for oral cancer, the main two being alcohol and tobacco use. There are many other factors that come into play. Genetics is one of those, and possibly other habits that one may or may not do. In this country, it's not too common, but one of the things that we learn in dental school is chewing the betel quid. The patients pack this particular leaf into their lower lip or inside their mouth, and they're increased risk for cancer. Smokeless tobacco or chew also puts a patient at increased risk for cancer, and other things such as gum recession. But this is just a brief video to help inform not only patients but also providers on some of the nuances or tips and tricks that I can help you with, maybe for your not only your oral cancer screening, but information for the patient. So the first thing I like to start out with is patient education. And that's important because if the patient isn't on the same page as you, obviously, then you're going to be on two completely different wavelengths, and you may not be getting through or getting across the information that you want to the individual. The first thing I start out with is talking about alcohol use, if they use alcohol, or if they use tobacco, and how those are two very main contributors to increased risk for oral cancer and even pharyngeal cancer or throat cancer, not to mention lung cancer for inhaling smoke or any kind of those tobacco products. And that really stems from the use of cigars, cigarettes, smokeless tobacco even, and then of course alcohol usage and its frequency as well. So helping the patient understand that and coming from that point of view can also greatly increase their awareness and contribute to possibly cutting back on some of those risk factors and putting them in a better place. So as far as that goes, that's the education aspect of it. There's many other things that can stem from the questions they may ask or other tangents you may go off on or other habits they might even have that could contribute to this as well. So once that is through and I begin the initial evaluation, I always start extraorally, and it's a good thing to do so because getting into somebody's mouth, as my assistant pointed out today, and that we know, is very invasive. It's very up close and personal. And when you're going to examine someone's mouth, they may not feel comfortable with it at first. They may be a little hesitant. And so starting extraorally, I found, is a little bit of a way to help ease into that. And so the first thing I do after I introduce myself and go through the said education that we just discussed is palpate. And what I'm palpating are the lymph nodes. And some of the main areas I focus on are the anterior cervical chain. And what I do is I ask the patient to move their head from side to side, which partially activates one of the main muscles used in controlling the head and neck, and that's called the SCM, short for sternocleidomastoid. There are lymph nodes located anterior or in front of that muscle, and there are some palpitations that I do on either side to see if I can feel any type of potential red flag for a lymph node that may be hard or indurated, non-mobile, or not painful. Those are some of the 3 key factors I look for. Moving on from that anterior aspect, there's also a posterior, and forgive me if I'm not exactly pointing to where that chain would be, but there's a posterior cervical, and cervical just means neck, neck region, posterior cervical chain of lymph nodes. There are clavicular lymph nodes that actually are superior to this clavicle bone that you have, which is some people fracture or break. It's this collarbone. And so there are lymph nodes that run right above that you can actually just palpate and feel for. Some of those, for example, can be implicated in actually gastric cancer. So those are good areas to look as well. Preauricular, or right in front of the ear tragus, right here also. So again, the lymph node, but also examining the temporomandibular joint, also known as the TMJ. You have a joint on this side and you have a joint on this side. So getting the patient to open and close maximally and listening for any clicking, popping noises or discomfort that they may experience. So there's lymph nodes there as well. There's also an area right behind the lobe that I like to palpate just to see if there's any type of sign that I need to look out for there or finding. So once I do that, I move on to the lymph nodes that are located right under the jaw. There are submandibular lymph nodes. There are also actually submental lymph nodes right under the base of the tongue here, located just posterior to the genial tubercles that are located here on the aspect of the mandible that you can palpate. You got to push pretty hard, so it can be uncomfortable. But again, submandibular and sublingual lymph nodes are important to look for in this area as well. And then move up along the face and just lightly feel for any steps that may be indicative of any kind of fracture of the maxilla or frontal bones here. And once I do that, I'm pretty much, for the most part, done. There are also occipital nodes in the back here of your neck that you could also examine, but that's just a nice way to initially look at the patient and gain an overall evaluation. The very last thing I do is I do a quick but thorough sort of thyroid exam, palpating that thyroid, having the patient swallow, and feeling for any potential nodules or things of that nature that may indicate a type of thyroid disease. Once that's done, you move intraorally. That's, again, another intro, the extraoral aspect of it, and then you can move intraorally. Not only looking at so for patients that are watching this, you want to be having the provider look at the inside of your cheeks, along your gums, your lips, feeling the top and bottom lip, looking at your tongue, the floor of your mouth, the palate, and also looking in the back of the throat. And for the providers, obviously this translates to mucosa, all the mucosal areas in the mouth, the base of the tongue, the ventral and dorsal surface of the tongue, the sides, lateral, as we know those are implicated in higher rates of squamous cell carcinoma, and of course palpating the lips like I just mentioned, and looking at the gingiva. So intraorally there's also a lot of structures to look at, and you want to make sure you examine the throat or any kind of soft palate area in that pharyngeal region in the posterior aspect of that. So I hope that gives you a little bit of an idea of what the patient can expect, what the provider can possibly provide for them. It's not required, but it's a nice thing to do for the patient as far as your head and neck exam and your oral cancer screening exam. There are many other ways to screen for oral cancer inside the oral cavity. There are scanners that some providers may use, some doctors may use, light scanners. There are chemical methods and means of doing that. And there are many different presentations of oral cancer or suspicious lesions or non-suspicious lesions, the details of which we will not go into because they're so extensive, but just so that you are aware, those things are there. Later on this week, I will try to get into a little bit more detail about some of the smokeless tobacco use that we see in our patient population, which is very important to me as a periodontist because of gingival recession aspects in addition to the oral cancer risk, and maybe just describe some of what folks can expect to see with that usage. So if there's any other questions or comments, please post them below. Email me, please, at thedailyrintsshow@gmail.com. Comment, find me on Twitter, Instagram, at doc_gums. And I hope to see y'all out there and that you enjoyed the show. And I'll see you next time. Stay clean.